Welcome to Pre-Surgery Visualization, an audio experience designed for both your conscious and subconscious minds. Its purpose is to enable you to create a relaxed, positive attitude toward your upcoming surgery. Now, why a relaxed, positive attitude toward surgery? Well, for starters, daily living between now and your surgery will simply be more pleasant when your attitude is positive and optimistic. Worry and fear can be vicious cycles, and there is no sense in making yourself miserable over the next days, weeks, or months. But more than simply making your life more serene and peaceful, there is a wealth of research that indicates that a relaxed, positive attitude can also significantly improve the outcome of your surgery. Let me say that again. There is a wealth of research that indicates a relaxed, positive attitude can also significantly improve the outcome of your surgery. People who use hypnotism and creative visualization to prepare for their surgery have been shown on average to require less anesthesia during surgery and less post-operative pain medication, and even to exhibit less bleeding during surgery itself. It's worth repeating. People who use hypnotism and creative visualization to prepare for their surgery have been shown on average to require less anesthesia during surgery and less post-operative pain medication. Now, does it sound like learning to relax and project a positive image of your surgery is something that's worth having? You bet it is. And this CD program can help you do just that. For your convenience, it's divided into 3 sections. The track you are listening to right now is a brief introduction to the program. The second track is a self-hypnosis relaxation segment. The third contains a series of suggestions designed to help you create and maintain a positive, relaxed attitude toward your upcoming surgery. You can use your CD player's skip track button to start on track 2 if you'd like, so you don't have to listen to this introduction repeatedly. And if you'd like to skip the hypnotic relaxation segment, just skip the second section and start right at segment 3. For background, my name is John Koenig. During the over 25 years I have performed hypnosis, I've been honored to help a number of patients prepare for their surgery, both privately and for 3 years as the hypnotherapist in a major hospital's complementary care program. The hypnosis segment of this program is designed to add power to the suggestions that follow by at least partially bypassing your conscious mind. Now, hypnotism is absolutely safe. Hypnosis is a fully natural state of mind, like sleeping or waking. There is nothing dangerous or occult about hypnosis, and there are no side effects. You will be completely in control throughout the entire session. If an emergency happens, you'll be perfectly able to cope with it. However, I do know that some people are reluctant to try hypnosis, partially because of the negative images of sensational movies and books, or their personal beliefs. If you are one of these, by all means skip right to track 3, where I may use relaxation imagery, but not formal hypnosis with the positive suggestions. To get the most benefit from this program, just sit or lie down comfortably. Make sure you will not be distracted. Cell phones turned off, for example. It's important to know that all hypnosis basically is self-hypnosis. A hypnotist is just a guide who provides a structure that can help you reach a level of deep relaxation and receptivity where you are far more open to accepting new ideas and feelings and behaviors. Therefore, at any time you wish, you can return yourself to normal consciousness simply by wishing to be back to normal and opening your eyes. Understand that while I am talking, you are going to have all kinds of thoughts that will cross your mind. Thoughts about your surgery or what to expect after it, but other thoughts will also cross your mind. Let me suggest that right now you consider none of these thoughts matter. None of them. You have made a decision to undergo this surgery, or you wouldn't be listening to this recording. You have weighed the benefits and the risks to the best of your ability, and have made a decision that this surgery is the right course of action for you, perhaps the only course you see as possible. So, given that, The only question that remains is how relaxed and optimistic you are going to be about the process. So there really is nothing much to think about when you stop to think about it. Just relax and use this recording to program your emotions and thoughts for the best and most positive outcome possible, which is health and a good rapid recovery. But before we begin, let me suggest you take a moment to revisit your reasons for needing to have this surgery. There may be more reasons than you realize once you start thinking about them. Think not only of the obvious advantages, like recovering your health, but also of the things you will do when you have regained your health, and the way you will feel about yourself and life in general. Stop the recording for a moment if you need to, especially the first time you listen. The next phase is the hypnotic experience. When you have reached a good level of mental and physical relaxation through hypnosis, I will introduce a series of positive suggestions. Their purpose is to transform your thinking, to eliminate fears and anxieties, and replace them with a feeling of peace, serenity, and positive anticipation. To begin, I would like you to imagine a staircase. Using staircase imagery is a very traditional way of inducing hypnosis, and from this point onward throughout the recording, the only major instruction is to simply forget other thoughts as they occur, thoughts other than the sound of my words. Just let them be there for a moment, and then gently dismiss them, and return to the sound of the words. The staircase you imagine can be any staircase, one you know or one you make up. Doesn't really matter. And don't worry if you can't picture it clearly. Most people really can't. Just get the idea of the staircase in your mind, like you are actually standing on it, or watching yourself on a television screen. And know there are 10 steps to the staircase, and each step takes you down to a deeper level of peace. While I am talking, you're going to have all kinds of thoughts. Thoughts about hypnosis, but also ordinary daily thoughts will likely cross your mind. I'd like to suggest again that you consider none of these thoughts are important, that all that matters now is listening to the sound of my voice. After all, you have already picked your surgeon and medical team and have committed to have this surgery. You've already made your decision, and right now, your intention is to use the next 20 minutes or so to relax and create a positive, healthy attitude to the process. Therefore, there really is nothing much to think about. All there is to do is to relax and absorb new positive ideas, new positive feelings about your surgery and the healing process. So, on this staircase, one that you know or invent, see yourself step to the number 9 step, beginning to feel comfortable and relaxed. And on the 9th step, I'd like you to imagine you're holding a piece of fabric, a piece of velvet, and that this is the smoothest, softest, most luxuriant velvet in the entire world. And then take that feeling of smooth, plush silkiness and apply that to your breathing. Good. And now step down to number 8. On this step, I'd like you to imagine another image people tend to find very relaxing. I'd like you to picture yourself out in the country by a lovely, peaceful lake in the middle of a forest, and to see yourself there as though you are in the middle of a vacation not only from work, but from all of life's responsibilities, worries, and concerns. A complete mental, physical, emotional break from your everyday life. Now, you might envision yourself on this vacation after your surgery is complete, and you are well and fully recovered. By this lake, you obviously hear the birds singing in the trees, and their voices are very soothing. They seem to touch a part of you that is ready to embrace peace and feelings of safety and security. But you might also be able to actually see them, sitting in the trees or flying across the lake. Or perhaps you're more kinesthetically oriented, and you're able to feel the warmth of the sun or the texture of the warm grass under your bare feet. Or maybe you can even sense the perfume of the flowers. Whatever you're experiencing, though, the important thing now is to be on this wonderful vacation and take that feeling and see yourself step down to number 7. Here I'd like you to experience another relaxing image, to imagine your body as though it were the body literally of a rag doll, loose and limp and flexible. A way to get this feeling is to imagine what it would feel like if all the joints in your body were to melt, become liquid. The joints in your ankles, knees, hips, your wrists, elbows, shoulders. If all of these major joints were to relax and become liquid, your arms and your legs would just hang there, loose, limp, and lazy. And now beyond that, imagine that your muscles are becoming relaxed. Imagine that your feet are as relaxed as if they were getting a foot massage. And let that relaxation move up to your calf muscles, relaxing them as completely as possible. Then, let the relaxation move to your thighs, so your legs and your feet have your permission to relax completely. Let the relaxation then migrate next to your hands. And as your hands let go of the day's tension, let your whole body cycle down, slow down. The relaxation moves next to your forearms, then to your upper arms. So your arms and your legs, your feet and your hands all have your permission to be totally, completely relaxed. Let that relaxation now move into your shoulders. Imagine you are getting a deep tissue massage in the shoulders, with the fingers finding tension you didn't even know existed and releasing it. Then let the relaxation move to your face. As your jaw relaxes, you might notice your teeth open slightly. And the relaxation then moves to your cheeks, to the little muscles around your eyes. As your eyes relax, you might notice that they start to tear a little. And that's perfectly normal, as your eyes let go of all tension. Then into your scalp. And as it does, you might experience a tingling somewhere, a pleasant tingling indicative of deep relaxation. The relaxation then goes over the top of your head and down your neck. From there it emanates out through your nervous system to every single cell in your body, even to your brain itself. And as it does, the neurons in your brain would fire more and more slowly and faintly, so your thoughts would slow and become fewer and further between and much less important. Even your bones relax and become soft and malleable. And with that feeling, see yourself step down to number 6. Here, notice that time has no importance. It doesn't matter whether a minute goes on and on and on and on, or whether it flies by in a second. You will feel even more relaxed, more at peace, and step down to number 5. Here, notice that space doesn't matter. Your body could be anywhere right now, in the hospital recovery room, or perhaps healing comfortably in your own bed at home. All that matters now is the sound of my voice, remembering to forget other thoughts. They have no importance. All that matters is the sound of the words with the music in the background. And step down to number 4, deeper down. Deeper and deeper and deeper. Deeper with each word you hear. Deeper with each velvety breath. Deeper with each beat of your heart. Now, at this point, people usually begin to notice their bodies feel different from ordinary. Some people say their bodies become very heavy, almost too heavy to move. Yet other people experience the opposite. Their bodies become very light, almost floating over the bed or chair. And other people notice their bodies become very still, almost like the body of a statue. And all that moves is their breathing. And that is a very interesting place to be. Your body so relaxed, it just doesn't want to move. Your mind relaxed and listening to the sound of the words, opening to new thoughts and new feelings and new behavior. Other people lose track of parts of their body. They lose track of their arms or legs, or maybe they experience themselves as pure mind. Other people simply become very relaxed, more relaxed perhaps than they've been in years. Whatever you're feeling, see yourself step down to number 3. What is happening is you are falling into a kind of a sleep, a hypnotic sleep, in which your body is asleep, yet your mind is fully alert, alert to the sound of the words. Step down now to number 2, and then to 1, and then all the way down to the floor at the bottom of the staircase, perfectly relaxed and completely at peace. Your subconscious mind is now in the ideal state for visualization and suggestions to create a very optimistic attitude and sense of serenity and peace regarding your surgery. Now again, just settle back and relax as completely as you can. You have made the decision to have this surgery. You have thought it out and decided it is the best course of action for you, perhaps the only course of action. Now all there is to do is to relax yourself about it and get into a positive frame of mind. To begin with, whether you are of a spiritual nature or not, you might start by considering the wisdom contained in the very well-known Serenity Prayer, in which a person asks for the serenity to accept the things they cannot change, the courage to change the things they can, and the wisdom to know the difference. Clearly, you cannot change the conditions that have led you to seek out and plan the surgery. If there were another way to restore yourself to health or achieve your goals, you would have taken it. Your surgeon would likely even have recommended it. But there isn't, or you would have taken it. Surgery is your choice. You have reviewed your reasons for choosing it and added up the risks versus the benefits and found the result clearly points to the necessity of this procedure to achieve your goals of health and happiness. You have picked a surgeon, medical team, and facility you are confident in, and now all there is to do is to accept these decisions serenely, peacefully, bearing in mind all the while the irrefutable benefits of going into surgery with a relaxed, positive mind. Rebelling against your own decision or bemoaning the fact that surgery has proven necessary is more than a waste of time. It is a destructive use of your time that can actually slow down your recovery as well as make you miserable beforehand. And those are things you do not want to do. You want to recover as quickly and as completely as possible and lead a peaceful, serene life until surgery, don't you? Of course you do. So, what is there to change now? Your attitude. And of that, you are in complete control. To help you accomplish this, I'm going to make certain suggestions and ask you to join me on a little journey, a journey into the future, your future, in which you will have a chance to program in exactly how you want to think, feel, and act about the surgery process. And remember that this is your program. You are the boss here and throughout your entire surgery. If I say anything you don't like or agree with, then simply ignore it. Or better yet, replace it with your own positive suggestion. Now, I'd like you to imagine that when it comes to your surgery, there are 6 levels of relaxation that you will pass through. The first begins right now. This moment, as you contemplate surgery. In this level of relaxation, you begin to experience not only a sense of peace, but also a quiet and growing feeling of anticipation. You find beginning immediately that you have a wonderful sense of peace. You have made your choice. The outcome is now in the hands of the people you have selected to care for you, and this is as it should be. If you are of a spiritual bent, you may find yourself trusting more and more in a power greater than yourself to guide you through this process. You are far from alone. You have the medical team of your choice, and perhaps spiritual support as well. All that is left is to relax and go along with the flow, and there is a wonderful sense of peace in that choice. Nothing to do except relax and let the healing begin. During this phase, you will find yourself more and more projecting how healthy and positive you will feel when your recovery from surgery is complete. Even if there will be more surgeries necessary in the future to bring about total health, you will begin immediately to celebrate and anticipate the step toward health and happiness you are taking with this surgery. Each day you wake, you will find yourself thinking, I am one day closer. Soon this will all be in the past. It will all be behind me. It may strike you as odd as you get closer and closer to the surgery that you notice you feel more and more peaceful and positive. This is a good decision. It is the right decision, or you wouldn't have made it. All there is to do is be at peace and allow the healing to occur. As you go to sleep at night, you will find yourself picturing how wonderful you will feel when the surgery is complete, reviewing the many benefits, and you will sleep beautifully, knowing that all is as it should be. When you go to meet with your doctors for pre-surgical visits, you will find that you are relaxed and attentive. Perhaps you can even picture yourself in your doctor's office right now. You listen and hear exactly what the doctor says. When you don't understand something or have a question, you speak up. You might even write down questions before you go for the visit. You are an active partner in this process, not a bystander. This is your surgery, and you are in control. As your doctor explains the risks of surgery, you listen carefully. You want to understand the risks exactly as they are, but you also don't want to over-dramatize them. So you ask questions about how likely the particular risks are and make your peace with the answers. No surgery is without risk, but neither for that matter is anything people do. And we learn to put the risks in the back of our mind, rather than dwell on them once we have made our decision to go forward with a particular course of action. And you will find as you face the risks that you are far more courageous than you may have thought. Most people rise to the occasion when facing surgery, and you are one of them. Each time you listen to this recording, you are strengthening your confidence in the process and confidence in yourself. You will go through this with far more grace and ease than you may have imagined. People in your life will be amazed at how serene and at peace you seem, and that is a very good thing. And you will be surprised at your own inner resources. The second level of relaxation starts the moment you wake on the morning of the day before surgery. This will be a day of heightened anticipation. You are now looking forward to having this whole thing behind you, to going through surgery gracefully and moving on to recovery and health. You find it easy and natural to follow your doctor's instructions the day before surgery. What is more, you have no desire for food whatsoever the night before the procedure, if this is the instruction. And this may surprise you. It might be because you know that an empty stomach the night before surgery is essential for success, or simply because you have just prepared yourself that you will not need food the night before. But definitely, you have interest only in water and then only following the doctor's instructions. If you are a smoker and your doctor has asked you to stop before surgery, it's possible you stopped days or even weeks ago. It's also possible that you make a point of not smoking or minimizing your intake of cigarette smoke. You want to do everything you can to help your surgeon do his or her job, and every cigarette you don't smoke before surgery is a positive step in this direction. Alcohol consumption has had no interest for you for at least 24 hours before surgery, and longer if your doctor suggests it. You want to do everything you can to help your surgeon, and every alcoholic drink you don't have before surgery is a positive step in this direction. As a result, as you go to sleep the night before surgery, whether you are at home or in the hospital, you feel very relaxed, with a quiet anticipation of the next day. It will be so interesting to see just how relaxed you can be tomorrow, and how rapidly you will recover. You will be proud of yourself, and very pleased with the results of positive thoughts and feelings that have put you in the ideal position for a successful surgery and recovery. You are in control. You have done what you can to assure the successful outcome of this surgery, and it feels wonderful to know that you are really handling this far better than you imagined you ever could. The third level of relaxation occurs as soon as you enter the facility for your surgery. It might be the day before surgery if you are spending the night in hospital before your procedure, or it might be the day of the surgery itself. See yourself doing so right now. Imagine the sights, the sounds, the smells, and it is very interesting that these sights, sounds, and smells, as you experience them, are totally soothing and relaxing. They give you the sense of teamwork and competency that you are in an environment dedicated to one purpose, to making you well. There is something very familiar about these sights and sounds and smells. They seem just the way you would expect them to be, because the hospital is a special place, a place of healing. It should be easy to imagine yourself there and totally relaxed, especially if you have been there before. Just remember what it was like. If you haven't been yet, then use your imagination to picture what it might be like. It could be the day before surgery if you are spending the night, or it might be the actual day of the surgery. But as you pass through the doors, you enter an intensified state of anticipation and acceptance, peace. You find yourself thinking of the hospital or any other facility as a place of healing, not of illness. You think of the hospital as a place to get well. You look at all the professionals, nurses, doctors, nurses' aides, and orderlies as people on your team. You appreciate their training, dedication, and experience, confident that you are in a place of healing. It is very interesting that in your interactions with other patients, including roommates if you have one, or meet other patients in the waiting areas, that you are focused on making them feel comfortable. You actually seem to forget about yourself and focus on their well-being, reassuring them and letting them experience some of the serenity you have been developing by using this meditation and visualization. You are so close now, and you find yourself often thinking that this soon will be over and the recovery and true healing can begin. The fourth level of relaxation occurs when you enter the pre-surgery holding area. Time seems to go by very fast here, and that's fine with you. You are already focused on the healing and recovery process. You are calm, confident, relaxed, optimistic, and cheerful. Yes, even cheerful. It is likely here that someone may say to you something about how relaxed you seem, and you might answer, why not? I know I'm going to do this, so I might as well relax and enjoy the show. You might be brought from here on a gurney or wheelchair to the operating room. It may amuse you when you hear the nurses talking about the OR, and you may find yourself thinking, well, at least I'm learning a lot of hospital lingo. During this time, you may again surprise yourself to notice that you are daydreaming about things that have nothing whatsoever to do with the procedure, and the thought will occur to you that I must be very relaxed indeed to be letting my mind just drift and dream this way. Before you know it, an orderly or nurse has come to bring you into surgery, and you may find yourself feeling a wave of relief, knowing this will soon be over, and you will soon be on your way back to recovery and health. The fifth level of relaxation begins the moment you enter the operating room. At this point, your focus is truly on recovery, and you can imagine yourself coming out of anesthesia, whether general, regional, or local, and beginning to heal. Experience yourself there right now. Feel yourself there. As you look around, the equipment in the operating room seems very reassuring. Science has gotten to such a wonderful level. There is so much support here, and in the skills of the people who will be attending you. Together, you and the medical staff seem like a team of which you are the captain. Everyone in the room is there for you, for your well-being, for your health and success. You relax even further and begin to focus on your breathing, observing your breath and thinking the word heal. If a nurse puts a breathing tube on your face, there's no problem. Still observing your breath inward, and as you think the word heal, in easy synchronization with your breathing, you relax even more. You might or might not feel like saying something to the people around you. It doesn't matter. You are so focused on the healing and recovery that it is almost as though you are not there. They may inject you with anesthesia or use another technique. It doesn't matter either way. You just observe your breath inward, and as you breathe in, you think the word heal. It is so relaxing, so soothing, so comforting to know all of this will soon be over. And time does seem to go by very, very rapidly. It truly is over before you even know it. If you are receiving a regional or local anesthesia, you simply keep your attention on your breathing throughout the entire procedure, observing your breath and thinking the word heal in easy synchronization to it. Some people find it useful to picture a happy place at this point, some place where they've been at peace, like the mountain lake we visited earlier or a beach. If this works for you, by all means use it. Think of the place you might use right now, and anchor this place in your mind by pressing your thumb, index, and middle fingers together. Do it now just for practice. Thumb, index, and middle fingers together. When you do this anchoring gesture in the operating room, the scene will come back to you far more vivid than it is even now. See the colors and shapes as best you can. See how you are dressed in this place and whom you are with. Experience the smells, hear the sounds. Notice whether it is cold or warm. Note whether it is a place you've been before that has good memories for you, or one you're creating just for this purpose. Observe whether you are alone or with someone, whether you are outside or inside. Be there. With your thumb, index, and middle fingers together, it'll be as though you are back there. You may find it helps not to pay the slightest attention to what your surgical team is doing. You've put your faith in them. Now is the time to simply let go, let them do their jobs. Or if it works for you to stay fully focused on your surgery, you can still use the anchoring gesture, but stay alert to what is going on around you. Just keep part of your focus on your breathing. If you are going into general anesthesia, you will know that your anesthesiologist will monitor you to keep you far, far away from what is happening, in a place of blissful rest, a place of total peace, like the deepest, most restful sleep you have ever known. During the surgery itself, the muscles in your body will remain absolutely relaxed. This makes the surgeon's job much easier, as there is no resistance. As a result, the surgeon notices there is less bleeding, maybe far less bleeding than he or she is used to. They may even remark on this after the procedure is over, that the surgery went so well, partially because you were so very relaxed. And when you wake, or they wheel you out of surgery, you will enter the 6th level of relaxation and focus, a state of mind quite different from the other 5. Here you will find yourself focusing on healing and communicating. Healing and communicating. You will have no hesitation about asking for additional pain medication if you need it. On the other hand, if there is a surprising lack of discomfort, that is fine too. And you may pride yourself on requesting minimal pain medication. If there is nausea, You will continue breathing deeply and focusing on your breath till it passes. On the other hand, you will be prepared that there might be absolutely, totally no nausea at all, as many patients who have used these techniques report. You can picture the area of your body that the surgeon worked on and imagine the incision healing so fast, both on the surface of your skin and inside your body, healing. The inflammation leaving, and your body naturally restoring itself to balance and health in a way that the staff are surely going to notice. As the research supports, preparing your mind and emotions for your surgery as you are doing leads to more rapid healing both in the hospital and afterwards at home. You will be patient in the hospital with the transition from liquid to solid food, knowing that solid food is being introduced gradually so your body can ease its way back into normal diet. Before you leave the hospital or other facility, you will make sure you ask and have answered any questions that are important, such as dealing with the stitches or staples, signs of possible problems, when you can drive again, go to work, stretch, bend, lift things, shower, enjoy making love. And you find it very easy to follow these instructions after your surgery because you are absolutely committed to your health and recovery. The process that began long before your surgery continues long after the surgery is complete. Now, let these thoughts echo throughout your mind, and let my words go with you as you move closer and closer to your surgery date. Each time you listen to this program, you will go deeper than the time before, and the suggestions will become more and more a part of the way you think, act, and feel about your surgical procedure and health in general. And know that increasingly, each day that goes by, you are more and more ready, more relaxed, more confident, more focused on healing and recovery and health. Now back to full normal consciousness on the count of 3, ready for a wonderful day, feeling calm, confident, very, very much in control. 1, 2, and 3. I hope you found that helpful. And please stay in touch. Let me know in the comment section here in YouTube, or you can email me before the surgery if you want, but probably better after. Let me know how it worked for you and how you're doing. At the very least, I'm sure you'll agree it can't hurt to practice and cultivate a positive, relaxed mental attitude and a favorable expectation for the outcome on your surgery. The research seems to suggest that it can help a lot.